Study is revealing that simple steps like flossing your teeth and keeping up with your oral health can prevent dementia. Dr. Jamie Laviola joins us today to tell us more about why these little habits have such a big impact. All right, doctor, how is it that tooth decay could lead to chronic conditions like dementia?
Good morning, Esteban. So there's a lot of things, a lot of literature as far as dementia. What I want to get out there as far as the science is there's papers that say there is an associative relationship between dementia and periodontitis, or gum and bone, some of the bacteria that's present. As far as a causal relationship, meaning that bacteria in the gums and bone causing dementia, that has not been proven yet. But what I will say is, as far as overall wellness, inflammation in the mouth, bacteria, there's been about 53 diseases that have been studied. This is one of them. And if we don't look at overall controlling inflammation in the mouth, that is the one factor that has been studied at reducing inflammation, staying well, trying to keep teeth. And the reason that's important is because without proper nutrition, which could affect sleep, it can raise cortisol in the system, which is not something that we want. It can lead to other things, and dementia being possibly one of them. So at this point, again, the evidence is not 100% clear, but I personally believe 100% in a wellness model of even if someone has perfectly healthy teeth, but their gums are bleeding, there's something wrong. So we got to get to that. And from a home care standpoint, and also coming into the dentist to get your cleanings, even if your bleeding does not result in tooth loss.
Absolutely, I agree. So bacteria is a main source of the problem, and it seems like everybody's having a difficult time. How is it that you're able to fix these issues with your patients?
So we do an overall comprehensive examination. It's probably one of the more comprehensive examinations anybody's been through, including some salivary testing to see which bacteria is present, if it's above the threshold where it can cause damage or breakdown, which ones are more inclined. There's an inflammatory marker that we look at with a simple salivary test where you just swish and spit saline into a bottle, and we send it off to a lab to get a really nice metric to work from.
And for more information, you can visit drlaviola.com and on Instagram at Dental Masters of Alexandria.